Hi everyone, today we're here in my office in Selkirk, Tier 1 Health Naturopathic Clinic, and this is where I practice on 3 or 4 days of the week, usually Wednesdays, Thursdays, and Saturdays. And that's just a quick little overview in my swivel chair for those of you who haven't been to see me. And today I wanted to chat a little bit about what sort of conditions I see in my practice. For those of you who don't know, I'm Dr. Amy Kroeker. I'm a licensed naturopathic doctor in Winnipeg, Manitoba at the Centre for Natural Medicine and in Selkirk, Manitoba at Tier 1 Health, which is where we are today. And so I wanted to discuss a little bit about what I see in my practice. This is Naturopathic Medicine Week, so I'm trying to cover some of the basic info that people have in terms of questions. Why would someone come to see me, for example? So first of all, I want to just point out that predominantly people will see a conventional medical practitioner as well as a naturopathic doctor in combination. You don't have to choose one or the other. I'm not going to say, oh, you shouldn't see your medical doctor. No, I think they have a really important role to play in medicine, but I think that naturopathic doctors work really, really, really well alongside a medical doctor to make sure that you get the best of both worlds and get optimal, phenomenal health. So that's what I'm passionate about, and so that's why I say we work together. So what I see in my practice there's a couple different categories. Let's talk broadly about the categories because I could list 1,000 different conditions one by one, but of course I don't want to do that. So I see digestive disorders, I see endocrine and hormonal disorders, I see skin issues, which are near and dear to my heart because I've struggled with acne and skin conditions for it seems like entire life. And so it's something that I've always passionately researched, and I love working with skin conditions just because to see someone have amazing, clear, radiant skin and to be able to give a person back the confidence that comes with is just so rewarding. So I see a lot of that, and I will also see a lot of neurological disorders and or mental emotional disorders. So those are also an area that I'm extremely passionate about because those areas, neurological and mental emotional, are constantly evolving, and they're evolving at such a rapid rate in terms of the research, both in natural therapies as well as conventional therapies, that every single day there's probably something new that we're learning about those systems and how they the interplay between the mind and the body, the interplay between the neurons in your brain and the bacteria in your gut, for example. Those are just constantly changing. So we learn something new every day, and that's why I love to research about those things. I love learning new things. So any challenging case, that's another area I would say that people come to see me a lot, is if it really hasn't been diagnosed or well understood from a different perspective in medicine. So I see a lot of patients who have gone to many specialists, and for whatever reason everything's popped back up normal or inconclusive. It's just sort of vague. The person has a lot of symptoms, and they can be really severe symptoms, but the testing comes back and there's nothing really going on. So that's a great time to look at a naturopathic doctor because we have a totally different viewpoint on the body, and not just looking at the numbers in their normal reference ranges, but the reference range that's specific for you. And that can make all the difference in the world sometimes with treating someone. So that's a whole nother category where I see people who have been to many, many, many other specialists, and they finally get the help that they're looking for in naturopathic medicine. So, and then of course there are some people where I say, you know what, I might not be this most specific practitioner for you. Or maybe you want to see someone who has more research or has done more work with a certain condition. The one that I'll mention for myself is I don't typically work with cancer. I'll work post-cancer radiation or preventative for cancer, but I don't work with the actual treatment of cancer. There are other naturopathic doctors who've done a lot of extra research in how natural therapies work in combination with chemotherapeutics and radiation and other cancer therapies, and they're better suited to those conditions. So typically if someone comes to see me, I will say, I think that I know who you want to see, and I'll refer them on because I know who to refer to. There are several here in Manitoba and elsewhere in Canada, and of course lots in the States, that are working more specifically with that area. So that's one area that I don't really work with. So going back a step, let's talk about the digestion a little bit. Digestion, things like irritable bowel syndrome. You're not technically or usually given a lot of guidance when you see a medical doctor about IBS because it's a very vague grouping of symptoms and there's nothing wrong with the structure. Crohn's and colitis, those are IBD, irritable bowel disease or inflammatory bowel disease, and IBD is something that's wrong with the structure of the gut. IBS is a sort of a vague collection of symptoms that basically your gut is inflamed. That's the diagnosis. So that doesn't really give us a lot of information. So my question always is to the patients with IBS is what's causing the IBS? Why is your gut inflamed? And that is the question that really needs to be answered in order to get to the bottom of that condition and to have effective treatment so that you can feel good. No one wants to get dressed up for a party and put on a really nice dress and then eat one bite of a food that they don't even maybe know which food is causing, and then all of a sudden feel like you have a food baby and your dress doesn't look good anymore and you're just bloated and you want to go home. That's super common with IBS, where you feel gassy or bloated or uncomfortable, or you have pain in the abdomen, and it's unknown what food might have caused that, or what set of circumstances, or why you're not digesting, or why your gut is inflamed. So that's something that I've actually talked about in a previous video, but I see a lot of that in my practice. That'd probably be something that I would see on a daily basis. So it's something that is just a core component of what I do. And we can do further testing on that, food sensitivity. Sometimes I'll do stool testing. I'll do a lot of different types of tests to get to the root of what's going on there. And then I'll see hormonal. So I mentioned before, things like thyroid, for example, perimenopausal symptoms, PMS. I see PCOS. So there's a lot of stuff that's going on with hormones, and especially nowadays we have a lot of things in our environment, a lot of different materials that we build normal things in our environment out of that can sometimes mimic estrogen, for example, or can lower other hormones in the body. So it's a very common thing to see in my practice that there's some hormonal issues going on for women and for men both. I would say it would be equal, that the amount that I would see disorders in those two areas. And I will also see, what is the other one that I talked about? We had mentioned the thyroid, but I'll mention it again briefly, that I do treat thyroid disorders. And that's something, again, where the reference range is a really large reference range, and everyone is very individual on that. So you could be feeling really lousy and be either taking thyroid hormone or not, but just be testing within the normal reference range, but you might still have a subclinical, I guess we would call it subclinical hypothyroid or subclinical hyperthyroid. Hypothyroid, the low functioning of the thyroid, I see more commonly in my practice, but I have seen both and had good success with helping the body to support the mechanisms that are causing the symptoms to be more severe for you. And so those are the basic things. And then of course the neurological, I see anxiety and depression. That would again be an almost daily thing. And what I love testing, as I mentioned in the last video, is the neurotransmitters, so that we can see what's happening in the brain. I like to see serotonin and dopamine and where are those levels at, so that I know specifically what I'm trying to treat. Unless I know that it's a serotonin issue, sometimes it comes back to the gut, or it can be a different problem altogether. So just I never like to jump to conclusions on that. And I always like to do a little bit of investigative work just to make sure that we're not just pounding our heads against the same wall over and over, and really helping you to feel better as quickly as possible. And the other neurological disorders that I see, I do a lot of work with diet and specific supplements to lower inflammation in the brain. So post-concussion disorders and Alzheimer's and Parkinson's and things like that it's very important to look at inflammation and whether that's impacting the brain, because that can really, really impair brain function. So people know generally that when you get a concussion that you can feel really foggy in your thinking. There are many, many, many other symptoms you can feel, but that is the one that sort of everyone knows, that it's just not clear. The thinking isn't clear, and it can go on like that for many days or weeks. And for some, post-concussion syndrome lasting years, and or coming up later in life when they didn't necessarily have those symptoms earlier on. And that's a core component of inflammation, is that it's sometimes silent for a long period of time and then it pops up. So that's something that you got to look at. We have to look at in order to treat effectively. So those are a few of the conditions that I see on a regular basis. I hope that helps to give you a sense of what naturopathic medicine is and what I do. And I look forward to doing more videos. And if you have any specific topics that you'd like me to talk about, I will be making many more videos. So if you want to hear me talk about hormone disorders or something specific like the thyroid or acne or anxiety or depression, then just send me a little message and let me know. Take care, guys.